Today, I want to talk about the level 2 travel alert that the CDC issued for polio. So, most people have heard of polio. It is a virus that spread through the fecal oral route, and most people don't even know they're sick if they get polio, but a very small percentage of people can get paralytic polio, which was a major epidemic in the United States and Western world in the 1950s, leading to the famous discovery of dueling vaccines, one by Jonas Salk in my hometown of Pittsburgh and one by Albert Sabin. The Sabin vaccine is the predominant vaccine used in most of the world, and it's an oral vaccine. And it's a live vaccine, and it provides really good immunity. But in a certain percentage of cases, that viral strain can mutate in someone's body or mutate in the sewer when it's recombining with other viruses, and it can get virulent, meaning the vaccine-derived strain can cause paralysis. So what we're seeing and what prompts this CDC alert is that multiple countries have circulating vaccine-derived polio viruses out there. And if someone is unvaccinated and they get infected, they may end up with paralytic polio symptoms because of this vaccine-derived, Sabin-derived strain. So if you're someone that's up to date with your polio vaccines from childhood, you don't really need to do anything. This is something to make sure that those individuals who might not have been fully vaccinated against polio are up to date, that they're thinking about this. And this isn't something that is just one place. Even the United Kingdom is included in this travel alert. So this is Europe, Asia, Africa. And there are two countries where wild polio, the original type of polio, not the vaccine derived, still circulate. That's Afghanistan and Pakistan. So this alert is something just to keep people keep it in mind when you travel, that this is a risk, but predominantly a risk of those who've never been vaccinated against polio. In the United States, we use the Salk vaccine. There have been times when we use Salk and then Sabin and combination. Now it's all Salk vaccine, which is a killed vaccine that you get as an injection, which doesn't have this risk. But one of the inherent risks of the Sabin vaccine is this ability for these viruses to circulate and sometimes revert or gain virulence and be able to cause paralysis. Actually, one of the advantages of the Sabin vaccine was that these vaccine strains circulate and maybe they give other people immunity, but there's this small chance that they can get virulence, and this is a complicated story, but that's what this travel alert is about. But if you're fully vaccinated, I wouldn't have much to worry about. There's not much to worry about here.